The environment for the private practice of cardiology has been very tough for the last year. Changes in payment made by CMS over the last 2 years have made practice more difficult. It is more difficult for cardiologists to reach the bottom line, as they say. It has been a more difficult session as far as strategy on how to work your private practice, whether to become employed, whether to integrate with other hospital systems. So I think the private practice of cardiology has been stressed. We have seen that. The college has heard this many times over the years. Jack Lewin has tried to address this. Obviously, making changes in the federal government is very difficult. So what we have seen is cardiologists making changes in their practice. We have seen much more alignment with hospitals. We have seen more profit sharing with hospitals in a way that hospitals and cardiologists can align, become more efficient, make savings in certain areas. So we've seen that stress in the practice of cardiology really convert to many more systems of alignment with hospitals. Whether that's good or bad really is in the eyes of the beholder. We see it as a potentially positive move, and so we want to prepare cardiologists to do their best to align in the best situation for them. One of the difficulties in integration is that hospitals look at things completely differently than cardiologists do. A lot of times cardiologists are focused on their office work and their outpatient and the things they do in the hospital, and they have this combined practice, whereas the hospital CEO or the hospital EVP or the cardiology manager is really focused on service line and profit loss and budgets and things like this. We really see a need for the cardiovascular specialist to integrate into that management structure of the hospital as well, and to learn about budgets and learn about spreadsheets and to learn about bidding and how all this works. It also is different in HR and employment and all the different areas. So we encourage the cardiologists not to just be on the sideline and to say, pay me and let me work, but they really have to be integrated within the hospital. They have to go from us and them to we, and they have to work together and see this as a family. And you would treat your spouse far differently than you would treat somebody else that you didn't know well. Therefore, the relationship of trust, the building of long-term goals and a longer-term vision far exceeds your short-term financial gain or maneuvering there. And we've seen that, not only the first year post-integration, but we've seen it now 4 years post-integration, that communication and relationship is critical towards the long-term vision and success. Just listen to Kevin Graham from Minneapolis Heart talking about 5 touches and the system of value that they build in for each patient and touching the primary care physician. Our own hospital system is looking into accountable care organizations and the patient-centered home, and where's the primary care physician going to be? Is there going to be less work for cardiologists? And we really don't worry about that. In an integrated system, we're really focused on our community, the care of our patients in the community. How can we best deliver that care together? It's not us versus them for primary care, just like it's not us versus them for the hospital. And so working together is going to be very important long-term. There's a shortage of primary care physicians, just as there will be long-term a shortage of cardiovascular specialists. So I don't think there's any shortage of work out there. There's a shortage of communication, and there's a shortage of people being willing to work together and trusting relationships. We spent an hour yesterday, as you know, in 3 different sessions going over the potential for horizontal integration and what does the 3- and 4-man group do. And we're going to spend more time this afternoon talking about the 3- and 4-man group and where do they fit into this as opposed to the mega group with 25, 30, 40 cardiologists. We see potential in alignment before. Sometimes a hospital who has 3 or 4 different groups of cardiologists who are working there. One group may be 10, one group may be 12, one group may be 6. Sometimes it's good for those groups to communicate before. Do they have similar cultures? Do they have similar goals long-term and vision? If they do, then a lot of times it's best for those groups maybe to work in tandem or at least communicate before going to the hospital. They may have advantages in numbers like that. Of course, if 2 groups have completely different cultures, think that they could never get along, and think that there's tremendous enmity between the groups, then that may not work. However, they have to realize that that may give the hospital an advantage in going after one group versus the other. If there's no communication between these groups, you run the risk of being left out in the cold. If the hospital can hire one group, hire 2 more cardiologists, and they don't need this second group of 4, then your arrogance may not pay off in the long term, or your lack of communication. So I think communication is the key there, Rob. I think groups talking to each other. I think leaders of groups meeting, going out for dinner, talking about saying, what are your goals long term, what are ours? How can we best serve our community? Could we serve our community better if we interface together with the hospital? Those are things to think about, and I think that each group ought to be thinking, rather than burying your head in the sand like the ostrich, I really think they should be thinking, do we need the other group? Do we need to work together? Would it benefit our community and our patients? Would it benefit the hospital if we all came together? Those are things to be thinking about, not us versus them. The one thing that we have been preaching to our cardiologists today is that if you're going to integrate into a system, we say, when should you start thinking about renegotiation? Well, actually, you should start thinking about renegotiation from day one, because the way that you build value in renegotiation is to build value in your unit and your relationship together with the hospital. You do that by building systems of quality, by cost savings for the hospital and your team together, by working on service lines together, by building networks that do outreach and that help primary care physicians to come in. So really, all renegotiation and value is together. And what you want to do is you want to build a win-win system to where that hospital CEO or that hospital COO or that hospital CFO looks and says, what a great decision we made to hire these cardiologists. What a great decision we made to go in with them. And if you learn to build value from day one, you have a vision for 5 years down the road and 10 years down the road, as opposed to how much money can we sign for today, then you're going to build the right system that's going to breed success. And breeding success for the whole system in a win-win is crucial. It's just like a marriage. You have to look, how strong is my marriage going to be in 5 years and 10 years, not are we going to make it through the honeymoon. When is the proper time to start thinking about governance and alignment? What do we think? I would say for any cardiologist in the country who may be watching this or who may be working with you, I would say the time is right now. The time was actually 2 years ago, but no time is too early and no time is too late. You must start thinking about forms of governance. You must start thinking about how can we work together in systems of alignment. Cardiovascular care is changing dramatically. It has changed dramatically in the last year. If you are not thinking about alignment, governance, counseling, as we say, being better, making a better system, you are behind the 8 ball. Whether you're a 2-man group, an 8-man group, or a 20-man group, you need to be thinking about all these right now. You need to have the intelligence and the fortitude to have your leaders working with others, making a better system. If not, you're going to be left behind. I think you see that at Paragon. I think you see that everywhere. If you're not working to improve, you're really falling behind.